Well, good afternoon and welcome. What an exciting day in the Texas Public Policy Foundation Hogsett Theater. You know, when we started these COVID live streams every Monday, we were very happy to go to all of you who are joining us via live stream. We love you to death, but we're really happy today to do this in person. And you didn't get an invitation because we're working out all of the kinks. We have to remember how to handle the technology, but we are trying to send a signal to every policymaker in this country, from the president to the governor to a member of the state legislature to our mayor to the communist members of the city council of Austin. Texans and Americans are ready to open, and TPPF is here in person for this live stream. So thank you all for being here. And that's not a political statement, certainly not a partisan statement. It's a statement about wanting to live, my friends. And it is proud on behalf of all of these TPPF colleagues here today, on behalf of the 28 million Texans, maybe 30 million Texans, considering how many people want to move here, and every American to say, enough is enough. We are very sorrowful for the people who have lost their lives from COVID. We're sorrowful for those families, including my own, who've had positive cases and people who've recovered. But that's also known as living as Americans. We invite risk every day. We have all kinds of viruses we have to deal with. We have to deal with all kinds of threats to our lives. And it is time to get back to the business of living as Texans and living as Americans. So today's live stream is going to emphasize that. And it is a great pleasure to have my two colleagues here. I'll introduce them shortly, but we have a guest joining us from well, I have to be careful when I say the best part of Texas because people get jealous. I happen to think one of the best parts of Texas and West Texas. Dr. Ben Edwards is the founder and medical director of Veritas Medical. He's been just a wonderful and articulate voice in looking at the data so that our policymakers can make data-driven decisions, but also balancing that in legitimate concerns about COVID-19 with equally legitimate concerns about the medical consequences of remaining shut down. I'm also joined by my colleague, Chuck DeVore, long tenured colleague here at TPPF, our Vice President of National Initiatives, as well as our good friend, Dr. Vance Ginn, the Chief Economist here at the Texas Public Policy Foundation. Gentlemen, thanks so much for joining us. For those of you who have joined via live stream, thank you for being a very loyal audience and loyal friends of this organization. Dr. Edwards, we are going to start with you, my friend, because you've been doing a lot of analysis, particularly on the medical side of the COVID-19 and shutdown. I just want to ask you to give us a 30,000 foot view here on September 21st, where we are medically with this issue of COVID, and also maybe a little preview about some concerns you have about remaining shut down.
Yes, sir. Well, thank you for having me. It's a pleasure to be here. Anything I can do to bring some normalization of our society back is what I'm here to do. And again, based on evidence, based on medical evidence, published data is what I've been talking about the whole time. And I will say a caveat, I'm not an epidemiologist, I'm a family practitioner. And I've done continuing medical education in the integrative realm, which just means a more broad and holistic approach considering diet and lifestyle. But that being said, I'm trained obviously as a medical doctor, went to UT Houston Medical School, and I was trained in how to read literature, how to read the medical data. So the 30,000 foot view is basically, we had a peak of death in July, and since mid-July through early August, mid-August, about a 6 to 8 week curve that we saw in death rate, and that curve is normalized. Hospitalization, same thing. We've been on, as the governor said last week, the hospitalizations peaked around 10,000 a day, and now we're down in that 3,000 range for COVID-19. So we see these spikes every year with respiratory viral illnesses. We have flu spikes every year. So we have a history to look back on. Unfortunately, the early predictions coming out of data out of China, we got way off. Obviously, I think everyone understands that now. The modeling was way off. So now we can see clearly. You can look at multiple countries across Europe, look across the northern United States, the southern United States. So we're over it. We're over that increased death rate from this respiratory virus. So from my opinion and looking at the data, the consistency of these curves across the board, we can clearly say that we are back to a more normal, if not totally normal. I just looked up the number of deaths, and I really look at the death rate more than anything, because cases, as we've come to understand, is a hard metric to follow, because how many people are you testing, and how many of those people were repeat testers, and what's the false positive rate? And, it's hard to make policy decisions based on cases. So I really look at death rate, and from COVID-19 deaths, again, the peak in mid-July, where we were averaging triple digits, anywhere from 100 to 200 deaths a day for that 6-week period. It's consistently gone down, 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 down to the past 3 days, 0, 1, and 1 deaths marked as COVID-19 deaths. So I think, again, the data is pretty clear. We're well past the peak. We're back to normalization, whether you look at hospitalizations, ICU data, but the most important to me is the death. So I think we're in good shape, and I think there's really no evidence, and I'm sure someone can try to debate this, but I'd love to see the evidence, because all I've heard is really mandates, statements, but then I don't see the evidence backing these statements up of why we should still be restricted at all. I just don't see how the data supports it. New England Journal of Medicine, May of 2020, and there's been multiple other studies say this, that outside of a hospital setting, masks really don't reduce transmission. And again, multiple studies. There's a study out of Wuhan looking at 3,400 contacts. Asymptomatic transmission, rare. That was a quote from Annals of Internal Medicine, August of 13th of 2020. Respiratory Medicine Journal, May of 2020, a similar study, 455 cases in Wuhan. Asymptomatic people are weak spreaders was the conclusion of that study. So if we know asymptomatic people are weak or non-spreaders, New England Journal said you have to have close contact within 6 feet, you have to be symptomatic, and you have to remain closely contacted for multiple minutes, 5, 10, even up to 30 minutes is what the researchers in that May of 2020 New England Journal article said. So if we know asymptomatics don't spread, we know the overall fatality rate is very similar to a seasonal flu, nowhere near the initial modeling. I just don't see the data that says let's continue to stay shut down. So from my opinion, medically speaking, we're back to normal, and we need to go live our lives that way. Now, that some of the negative impacts of not doing that, I can't even begin to measure. I have 6 children, so I really look at it from the child's point of view. These children are being trained to be scared of people, of viruses. And I'm not saying ignore a virus. When you're sick, quarantine. When you're sick, cover your cough. When you're sick, that's different. But where we've gone with this based off that initial modeling, it's fine to do that initially for a few weeks or a month until we got a handle on this thing. And Michael Levitt at Stanford, Nobel Prize winner, he was predicting these 6 to 8 week curves. Like he predicted Sweden was going to peak and then come down before it even happened, based off the data. So we've had this data in front of us for a long time. So to continue to bring fear and anxiety and the shutdown of society and the education in particular, I just talked to a principal of a local school. His teachers are so stressed out. If people only knew, stress is the number one thing that will undermine a healthy immune system. Fight or flight mode, stress. And these teachers are so stressed because they're having to juggle these online classes and live classes on all the different lesson planning. And he told me that he fears the retention rate's really going to drop next year, and he's going to be having to look for a lot of new teachers. So there's so many unintended consequences and impacts societally. We can look at studies, multiple studies over the years. I haven't seen one with this particular pandemic, but over the years, for every 1% increase in unemployment, 1% uptick in unemployment, you get 37,000 deaths that you can associate directly to that unemployment. So obviously 5% or 10%, you're talking tens and tens of thousands of deaths that we have to consider these other things. And I'm not saying just, again, ignore the virus, but we've got to balance our response. We've got to think about unintended consequences. And then we have to reanalyze that data that originally put us into this shutdown and just confess we were wrong. Repent. I tell my kids all the time, it's hard to repent when you know you're wrong, but you need to do it. It's what brings healing, is when we can repent. So I feel like we need to do that as a medical community and as a government. We need to do that, in my opinion.
about repentance. I think that as a think tank, all of us at the Texas Public Policy Foundation want to be focused on data. And so in March and April, when policymakers and some of your medical colleagues were saying, focus on the data, happily so. And I would say on behalf of this organization, of course, it made sense in the first few weeks of this pandemic to shut down for a couple of weeks and take stock of how contagious it was. But then the tune changed. And the tune changed from, oh, don't worry about the data. Your analysis of the data isn't as good as our analysis. And one of the problems, which we will in fact emphasize today, is that it's been very difficult, whether from the federal government or the state government or local governments, to get reliable data. The person who's been really at the vanguard of that for our foundation is Chuck DeVore. Chuck, I just want you to weigh in and speak to that point, as well as this point that Dr. Edwards was emphasizing, which is how we balance all these competing interests.
Well, certainly your point about the data is one of our constant and continuing frustrations. A lot of the way the data has been constructed is that for example, seasonal influenza, we know a lot about that. And as we found out, that the Centers for Disease Control have long established kind of algorithms where they look at people presenting to hospitals with breathing problems, and they make certain assumptions about, well, how many of these people have a virus, have influenza, how many people have pneumonia. And interestingly enough, not everyone is tested. In fact, very few people, because we're used to influenza, right? We've been dealing with influenza from the dawn of recorded history. And so a lot of the system that was set up around influenza. And then you get this novel coronavirus, this COVID-19, the initial projections, the estimates, the models showed potentially millions of people dying all over the world. Even in the US, they were predicting up to, I think, 2 million people. In fact, I think a certain politician gave a speech where he said something like 200 million people were
just yesterday he made
die
that
by the end of his speech. And I think, my God, that speech must really have been toxic or something. But by the way, if you're still alive, you're part of the fortunate 1/3 that survived. So congratulations. So the challenge then is you had this new virus and you had no mechanisms really set up to deal with it that were specific to the virus, as opposed to the influenza virus, which we're very much used to. And so initially you had the issues with testing. Are the tests accurate? What are the false positives, as you heard from our good doctor in West Texas? That's a big issue. You had the issue of, where did the person catch the virus? And we saw that in Texas, where even to this day, you see a higher rate of hospitalization down along the border towns, for example, in Laredo. And there is no data that's being published anyway that indicates how many of the people in Laredo who are hospitalized got the virus in Texas, or how many are, for example, U.S. nationals that live in Mexico and traveled across into Laredo for treatment, or might be Mexican nationals that are seeking better American treatment. So all of these factors together made it extremely difficult to get a good handle on the progression of this virus, who is at risk, steps that might be taken to combat it, or perhaps nothing. If you look at what Sweden did, where they just got along on with their lives and frankly don't seem to be any worse off than any other place that in fact completely shut down their economy.
Well, those are all good points. And I think about your point about Sweden, which Dr. Edwards spoke about quite a bit too, Chuck. And one of the predictions that was made 3 weeks ago, as colleges were coming back into session, was that we would see an additional surge in cases. And at least as of a couple of weeks ago, there were a couple dozen colleges sampled from around mostly the central part of the United States and the Southwest, 26,000 cases, 26,000 tests, 0 positive cases. The point is, and obviously we'll leave this up to the medical professionals to decide after the fact, it seems as if we've hit that point of herd immunity or something looking like it. And certainly for those of us who study numbers for a living, Dr. Ginn, we think that it's really time to get open. You would argue, as an economist who also cares about lives, that one of the important things about quality of life is making sure that you've got access to your job, you have access to going to church if that's what you decide to do, access to go to the coffee shop of your choice, access to the restaurant you want. And we need to balance, as Dr. Edwards has said, our concerns about COVID with those equally legitimate concerns, which are really mounting. Why don't you give us a 30,000-foot view of where we are economically in Texas and in America?
Yeah, sure. Thanks, Kevin. Thank you all for joining us today. It's been a wild few months. When this all hit, I was actually in the White House. I was working at the Office of Management and Budget at the time. So we had a good idea of where the virus was flowing, starting in China and going across the globe, and watching where the cases were increasing, watching the deaths, and saw that here in the United States as well. And then looked at the national emergency proclamation that was made, noticed what the states were doing as well with shutting down. And it's important for us to be able to understand the risks that there are available. One thing that we often don't understand as well are the risks that we take each and every day, whether that be driving a car or just walking down the street. And oftentimes we're biased upwards, right, to what that risk may be. And for the coronavirus, for example, for COVID-19, we hear about it every day. We see the caseload, we see the deaths and things of that nature. But I think it's important to look at what the share of the cases are here in Texas, for example. Looking earlier, it's about 2.4% of our population has been infected by the virus. So that means 97.6% of Texans have not been, yet we continue to have shutdowns, not fully open, not fully freedom across this great state of Texas. Something needs to be considered. Even across the United States, 2.1% of Americans have been infected in some capacities or infected with COVID-19. That's 97.9% Americans who have not. Yet we consider the vast amount of cost this has been to our economy, to our livelihoods along the way. Across America, the unemployment rate reached almost 15%, when it was 3.5% just in February, and the 21 million people who lost their jobs. Here in Texas, when you look at the private sector, there have been 1.3 million people who lost their jobs. Quite a few of them have gained their jobs back, but we're still 730,000 jobs below where we were just back in February. That's many livelihoods. And that's just to get back to February, much less the job growth that we were having before that, right? If you think about the additional job gains that we could have had otherwise. It's been devastating, to say the least, Kevin. And I think it's something that we have to be able to consider the trade-offs. That's one thing we do as economists, is look at the trade-offs, look at the opportunity cost for our actions. And as it may or may not have been the right decision to shut down initially, what we've seen is there have been a number of data points that have been used along the way, whether it be looking at cases, whether it be looking at positive test rates, which can often point us in the wrong direction for what our policies are. If we remember back just a few short months ago, the reason for flattening the curve was to make sure that we didn't overwhelm hospital capacity. So maybe looking at cases can give you a forecast of what's going to happen with hospitalizations later, maybe. Maybe positive test rates will as well. But one thing that we look at in economics is our forecasting is pretty horrible when it comes to economic models. And the epidemiological forecasting may be even worse, if you can believe that.
Worse than economist modeling.
Yeah, I know, it's bad, right? And so we've got to be really careful about falling into the trap of the tyranny of experts, where the precautionary principle rules the day, when instead we need to be thinking about how do we preserve liberty and lives and freedom along the way, because right now it's pretty unfortunate. The number of bankruptcies that have happened across Texas. We've had the most bankruptcies in Texas per 10,000 businesses of any state. And that's continuing to go up. And, I get a little fired up about it because I care so much about people. And when I see what's happening to my friends and families all across this great state and America, it's pretty unfortunate. And I hope that we can get back to our livelihoods as soon as possible.
Well, it's eloquent and forceful, and I think very, very well intentioned. The issue too, looking ahead, is we've got businesses that are staying afloat, those that are staying afloat, but they're running out of cash. And we know that beyond just the anecdotal examples, but we're going to see that in the next month or two, not just in Texas, but around the country. And one of the things Dr. Edwards and I were speaking about last week was your concern, Ben, about the flu season. Not that it's necessarily going to be a bad flu season, but that policymakers might use it as an excuse to at least slow the reopening, maybe even have us to go backwards into more of a shutdown. Why don't you speak to that concern?
Yeah, it is a big concern because obviously the flu season typically, I mean, it can vary, but between late fall, early winter, and even into the spring. So any uptick in respiratory viruses, I see there could be a great potential for politicians to use that as oh, we're having a second wave, or we're going to be overwhelmed again. They haven't followed the data well lately, so it's a concern for me that they won't follow the data going forward. So we just need to be aware and be cognizant of the fact and realize that every single year, I mean, every hospital I've ever worked in, Houston, Waco, we hear it on the news here in Lubbock. Every flu season, hospitals get full. ICUs even get full. Hospitals have a term called diversion or divert. They will divert those ambulances to the next hospital for a certain number of hours or days until they have a bed available again. So this is a common thing that happens every flu season. So, and we never freak out about that. So we need to be very, very aware that our hospital systems, and they're very capable of a lot of things, but they do reach a maximum capacity during flu seasons often. So let's just be careful. You combine that with the inaccuracy of the testing now. I've seen upwards of a 90% false positive in some of these PCR tests, which I can get into that if you'd like. But that's a deadly combination in my mind. We know we're going to see an uptick in respiratory viral illness and hospitalization. We have a very poor testing mechanism for COVID-19, and we have a population that's already scared and skittish. And if politicians follow polls, which they oftentimes do, then this is a recipe for a disaster as far as going back into a shutdown. So I just want to, I'm trying to sound the warning bell a little bit that we need to be expecting this. Although I will say, and again, I'm not an epidemiologist and I hate to even give predictions, and this may come across wrong, but the most vulnerable people who typically will die from respiratory viruses and pneumonia every winter, a significant portion of those have unfortunately passed away already this year. And I think that's why when you look at the Sweden curve, they had a little more death spike than some of their neighbors. But if you look back at the previous flu season, it was pretty flat. They had a very mild in terms of death. So they had a lot of susceptible people that did not die the previous year. So that could be a positive as we go into this flu season. A lot of the susceptible folks, unfortunately, have passed away. But again, it's something we just have to be aware of and bring our thinking caps. Evidence-based medicine is a kind of catchphrase in modern medicine. And I always remind my colleagues that call me and we talk about things. There's 3 parts to this evidence-based medicine definition that Sackett came up with in 1995. It's, yes, look at the best published data, peer-reviewed published data, analyze it because there's bias and there's a potential it's not a good study, but look at peer-reviewed good data. Use your clinical judgment and your experience. And the 3rd part of the definition is consider the patient's values and the patient's opinion and input. So it's not just this listen to a dictatorial mandate from on high. We as physicians, if we're practicing evidence-based medicine, need to consider all 3 of those. So going into a flu season like this, we need to be critical thinkers. We need to consider this big picture, look back at our history. I mean, I was there in Garza County Health Clinic when H1N1 hit, and so we need to remember, what do these epidemics really look like? And just keep our wits about us and not let the policymakers and politicians dictate. We can't be afraid to stand up with our clinical experience as physicians and speak the truth. So we'll see this winter what happens. Hopefully we'll have a mild season and it won't be a big deal.
Thanks, Dr. Edwards. Even if it ends up not being mild, 2 things. Number one, and not being dismissive of people who will be affected by influenza, that's not out of the ordinary. And number 2, I think we're fine from the standpoint of hospital capacity. We'll come back to emphasize that point for anyone listening who's concerned about that. It's a legitimate concern based on everything we're hearing in the media. But I want to turn to you, Chuck, because you've had some clinical experience in a really crazy field of medicine known as politics. And you were a member of the California Assembly and then woke up one day, came to your senses and moved to Texas. And I'm curious what you think is going on politically here. Obviously, we're in the middle of an election season. I just being a historian of this country, I know that this is getting politicized. you've got a very reasonable way of analyzing that for our audience. And so give us some wisdom, my friend, about what we need to see through in order to make good decisions.
Well, I think there's three things going on when it comes to elected public policymakers. First of all, as the good doctor mentioned, politicians do pay attention to polls. What a shock, right? So you've got politicians who, by the nature of having work to be elected, they think that the first thing that they need to do is to do something. They have to be seen as doing something, even if the unintended consequences might be worse than the actions they take, right? Because that's the position they're in. You can't say, well, I'm your mayor and the best thing is for me to do nothing, right? That's just not how they're wired, right? That's also not really public expectations. The second thing is that, generally speaking, there are, from a philosophical standpoint, there's a division in the way people look at risk. And this division is manifested today in the form that politicians that are more on the left or liberal side of things generally see government's job as mitigating risks. Now, that could take the form of, for example, a car seat law, or laws that say, you're not supposed to use your cell phone when you're driving. Laws about, for example, potentially increasing taxes on large sugary drinks, right? Those are, ways to mitigate risk through public policy. And then on the more conservative way of looking at things, in general, obviously there's exceptions. Politicians generally on the conservative side view things like that as really up to the individual. It should be an individual choice as to what sort of risks or behavior you want to take on. Now, obviously, there's exceptions. Now, there's a third thing I think that's happening as well, and this is perhaps the more controversial thing. The third thing is that we have an election, if anyone hasn't noticed, in something on the order of a little more than 50 days. What would be fascinating is if we were able to do a study on the number of mentions of COVID and the amount of time being spent on COVID by the major media networks and by politicians. And we were able to do that study prior to November 3rd and after November 3rd. In fact, as I recall, there was someone out of New York State, if I remember correctly, New York, where one of the officials involved with schools said that the schools will be open after November 3rd. And I'm wondering, was this like a Freudian slip? Did they really mean to speak that out loud? But one of the jokes around the office is that pretty much COVID will be over on November 4th. And there's reasons for that politically, aren't there?
There sure are. So, Dr. Ginn, why don't we invite you here to steer us out of the politics, which I'm afraid our colleague analyzed very accurately, and convey for our live audience, which is wonderful, and our live stream audience, also wonderful, 2 or 3 key points for them to keep an eye on as the reopening in Texas accelerates, let's hope, and hopefully the reopening across the country accelerates.
Yeah, I think there are a couple things that we really need to keep an eye on. One will be the hospitalization rates. So as of today, based on the Governor Abbott's executive order from last week, the COVID-19 share of occupied beds, that'll be the hospitalization rate that you'll hear a lot about coming up. For those trauma service areas, there are 22 of them across the state. If they're below 15%, then they can begin to reopen a little bit more than they otherwise were. So many places can open from 50% capacity to 75% capacity. That starts today. And on Thursday, nursing homes can start to have visitors again. So many people who are dying alone won't do that. Hopefully, at least have the opportunity for someone to go and visit, which will be important, I think. So hospitalization rates will be important. And the way that it's set up is it has to be below 15% for hospitalization rate for 7 consecutive days. So that'll be important. Because what happens if the area where we're in now, this trauma service area with Austin, if it jumps up above 15%, well, then you would roll back to the 50% capacity. So what I'm looking at is going to be what's the hospitalization rates, which I think is important given that was the reason for flattening the curve early on. It's pretty objective overall. So I think that's another key indicator there. But then also, what does this do for the public? How does this change their fear? Because you can have different responses to fear, right? You can you can have flight, fight. The other one is freeze. And that's what we saw a lot going back to just March when this really hit, was there's this social mobility factor by IHME, which looks at cell phone data and tracks how people are moving around. And what we found in March in Texas is it fell off a cliff where about 50% of our activity was happening from the prior month because people were kind of fearful. And half of that drop off was, I think, personal responsibility. People saying, you know what, this is there's a lot of cases coming up, so I'm going to stop going to the store as often, things of that nature. And then the shutdowns happen mid-March. So of course you're going to see a sharp drop off in social mobility. Well, when things began to open up again back in May here in Texas, that went from a 50% decline back up to 20%. So we're still about 20% below where we were just back in February. Okay. So will social mobility pick back up? That's what I'm going to be looking for there. And then finally, what does that mean for businesses? Given that there could still be some uncertainty, even based on these reopening criteria that was released last week and starts some today, there's a lot of uncertainty. And if you talk to some restaurants, even though they can open up to 75% capacity, just here recently, and here in downtown Austin, talking to some folks, they don't have the capacity to open up to 75%, given the other criteria of the 6 foot or the 6 feet social distancing rule, right? So that means that they're not going to be willing to put more investment into their business and hire more workers in the process because they just don't have the additional revenue that they're going to get. So when you think about it, hospital capacity, what's people's risk that they're willing to take now? And then for businesses, what sort of certainty? And I think when we look at those indicators, we're going to get a better picture of what's happening here in the great state of Texas.
Well, you didn't disappoint, my friend. Thanks for that. So we're a little past halfway through this production. So this is when you, members of the audience, both audiences, get to ask some questions. I'm going to ask one more question of you, Dr. Edwards, and then we'll pitch to audience questions. So if you're on the live stream, just enter your question in the comments box and that'll get sent up to us here. Obviously, if you're in the audience here in our theater in downtown Austin, you can raise your hand and we'll sort of mix those two questions from those two sources. Dr. Edwards, my question for you is based on some things I've been reading, obviously just as a layman, not at all a medical doctor, that there are medical harms that have come from people being at home. In other words, that as we look at weighing all of these competing interests, that maybe being at home has accentuated medical problems for people. I just want to give you the opportunity to speak to that.
Thank you, because it is an important thing I think we've glossed over. Obviously, mental health is already a big issue, especially in young people. We've seen an exponential rise in anxiety. It's the number one chief complaint for people under 30 years old when they go to the doctor. It's a mental illness type issue, and especially anxiety. So, and there's reasons I believe for that over the past 10 years. But that's exacerbating depression, suicide. Of course, we've heard stats on abuse, domestic abuse, alcohol. I mean, these alcohol sales that have maintained or even escalated. So just the way people cope, and some people cope well, some people don't cope well, and we know this historically. So the mental health side, the abuse side of things, but just your basic chronic disease patient, if you're not able to get to your doctor, have your routine checkups, your routine screenings, you're so scared to get out. I've heard this so many times, too scared to go to the hospital or the doctor. They're going to potentially miss a screening that could have, cancer is much more treatable when you catch it early. That's why we do these screenings. So there's an untold number of potential medical harms that could come. But to me, and this is my bias, I've seen such amazing health outcomes when we focus on diet and lifestyle. And people forget this. People forget that 95% of cancer is not from your genetics. It's not from bad genes. It's diet and lifestyle. It's the same with heart disease. 90 to 95% of all heart disease, it's diet and lifestyle. These are your top two killers. And it's these same diet and lifestyle issues that drive your susceptibility to COVID-19. I drew this little formula. Hopefully you can see it. Disease equals virus virulence, that's the V, virulence times viral number divided by host defense. I'm doing fractions with my kids right now, one of my kiddos in math. And what I've described, that denominator is so powerful. When you make that a big number, then your answer, your disease goes way down. That number goes real far down. We don't have a lot of control over virulence. That's how powerful the virus is. We don't have a real big handle on viral number either. I mean, we can try to wash hands and do some things. It'll mitigate it some, but host defenses, that denominator is so powerful. And the fact we're not focusing on that, even when CDC comes out and says 94% of these COVID deaths had underlying comorbidities, those underlying comorbidities means weak host defenses. It's the same things that cause you heart disease and hypertension and obesity and all these comorbidities that will increase susceptibility to COVID. So that's one of the biggest unintended consequences, medically speaking, in my opinion, is such focus on the numerator. And we have totally forgotten that denominator, or if we've not totally forgotten it, we sure haven't put a spotlight on it. And if we have done that, I think we would see we could just walk through these flu seasons with a lot less deaths. So lots of unintended medical consequences.
Well, leave it to the doctor to remind us to live healthy lifestyles. I mean, golly, doc. But thank you for that. Very important as it relates to the pandemic. So we're going to take our first question from our live audience. Just want to invite you to raise your hand if you have a question. No pressure at all. Just the first live question in 2020 since policy orientation. Yes, sir. Microphone's coming around to you so that our friends who are joining us online can hear.
I think this may be a question for the doctor. You're seeing a lot of Facebook groups pop up, at least I am, with parents, predominantly women, that are concerned about the mask mandates at school and really angry about that. Is that helpful? Does the mask mandate help? Is that leading to this chronic fear that students are suffering from? But I'd love to hear some thoughts about these mask mandates at public schools.
Thank you. Dr. Edwards?
Okay. Well, I think if you would show these moms who love their kids, obviously, we all love our kids and want to be healthy and safe. If you would show these moms really good data that shows and proves to them how their kid wearing this mask will help save someone's life. If you showed them that good evidence and good data, we'd all strap it on with no Facebook groups popping up, well, not many, to fight it. That's my answer. Where's the data? And so when they go look, when I went to look, when I looked at colleagues of mine who went and looked, all we keep finding is consistent data that these viruses are too small. They pass through the mask. The mask have unintended consequences, obviously, if you're breathing in your own exhaust over and over and over. And in kids in particular, when it is so clear that your chance of dying as a young person is practically zero. I mean, this virus has a very big disparaging number. If you're old and comorbid conditions, yeah, watch out. And if you're young, it really doesn't hardly affect you. And you look at the data for if you don't have symptoms. So if this kid's not coughing and doesn't have fever, the chance of spread is almost zero. Pasteur Institute in France did a study on kids and teachers in schools, and they saw this. There was very little spread in asymptomatic kids. So I have moms come to our practice with these same kind of questions. And so where do I turn? The data. And the data that I have to show them says they're right. The masks are not helping. Obviously, they're bringing at least fear, if not increased CO2 levels, decreased oxygen levels. You know, it's just, again, we've been so far off on the data that it's hard for me to say, no, those moms should get off Facebook and stop demanding some things. I mean, we need to listen to these mamas, is my opinion. We listen to our patients. That's rule number one, listen to your patient.
Thanks, Dr. Edwards. Dr. Ginn, you're just ready to jump in on this. So I'm going to turn to you and then we'll ask some other audience questions.
Well, I just think it's important to point out, as the good doctor from West Texas, I went to Texas Tech, so it's a good place up there. It is important to understand like how much we've learned and how little we knew about this before all this happened. And even today, the breaking news out of the Wall Street Journal, the CDC pulled new guidelines saying the coronavirus can be spread by tiny particles that linger in the air, saying draft language was posted in error. So that means that we really need to be considering all of these restrictions, mandates, and things of that nature, because there's so much that we're still learning about this process. And if you get back to it, I think it is about personal responsibility and good personal hygiene. I mean, one of the things I think things that could be a really good silver lining is that we're all taking care of ourselves probably better than we ever have before. I know my boys have been kept well over a longer period of time than normal, and that those are definitely good things. But let's also not take it too far where we're continuing to have mandates for a prolonged period of time. But, what it really comes down to is, good policy is usually something that's timely, temporary, and targeted. And unfortunately, we've come to policies that are ongoing and broad, right? And those are not usually the type of policies that work very well. And we should get back to those types of policies. And I think if we can really get the resources to those who need it most, that's how we can really help to fight back of COVID.
Well, thanks for that. So we'll take the next audience question. That's going to come to you, Chuck DeVore. This is from one of our live stream friends. What advice do you have for business owners whose staff do not want to return to work because they're making more with unemployment?
Well, there you get into both unintended and perhaps intended consequences. The challenge that you have with a divided government, where you have, in this case, the United States House of Representatives controlled by one party, the U.S. Senate and the White House controlled by another party, with our bicameral legislative system, is that if you're going to pass something, you've got to get those two chambers to agree and the president to sign something. And so when it came to the unemployment assistance, I think a couple of interesting things happened, right? You saw that one battle that was a battle between, do we give it to individuals or do we help businesses continue to meet their payroll even though they may be furloughing their employees or keeping them underemployed. That was the first major battle. And then I think another battle is over the size and extent of the unemployment insurance and then how long it's going to last. And you have certainly seen this within the restaurant sector, where some of the unemployment benefits do in fact exceed what some of these employees might otherwise make. And you saw, in fact, people in the Senate trying to address that, but there was no interest at all in the House to take that up. And so, again, this is a classic political problem between one side that believes in very high minimum wages. They think that government should dictate more of this stuff, and another side that thinks that this should be something that the private sector should be responsible for. And oh, by the way, how many trillions have we spent?
Well said. I'm going to turn back to our live audience here to see if there's an additional question. Yes, sir. Microphone's coming your way.
So the Texas economy seems to be improving slowly but surely. I'm wondering if Dr. Ginn can speak to some of the big ideas that the foundation will pursue in the next legislative session to get things back in roaring fashion.
Sure. So you're right. The economy has been improving. The unemployment rate, just announced last week, is down to 6.8%. We've got to keep in mind, like I said earlier, that's about double what it was in February. So we still have a ways to go there. There are key things that we need to be considering going into the legislative session, just a few short months away. The number one thing I think will be reopening, getting back to reopening to where there is calm, some sort of calm among the public, more certainty for businesses. I think that will be huge to get more jobs being created overall. I think continuing to find ways to affect housing affordability, in particular with property taxes, making sure that they don't continue to go up. Right now there's a discussion about whether they should go up 3.5% or 8%. And there was a great piece of legislation passed last session, Senate Bill 2, which had this automatic trigger to where if you want to go above 3.5%, you know what? You're going to have a vote for it. And I think that was phenomenal. But during a disaster like this one here, which isn't a physical disaster, some are trying to use a loophole and say, you know what? We need to go up to 8% regardless. Well, that needs to be done away with. We need to get rid of that loophole if it is one, right? And why are we even raising taxes at all? With so many people that are unemployed across the state, if you look at jobless claims or continuing jobless claims here in the great state of Texas, it's over 1 million. When before this, it was around, what was it? That's at the national level, but there's a lot of people that are still unemployed overall. That's what I'm getting at. Why would you want to be raising taxes? shouldn't be raising taxes. We should be thinking about cutting taxes, cutting regulations, and most importantly, limit government spending. And I think our state leaders have been doing a good job with that in the sense of calling for some state agencies to cut 5% of their overall budget. Probably need more than that. The comptroller recently came out and said we could see a $4.6 billion deficit during this current biennium. So we've got to make sure that we fill that in some capacity because we have a balanced budget amendment here in the state. So I think if we get to reopening, finding ways to continue to reduce the tax burdens on Texans and reduce the regulatory burden, those three things could really help boost the economy and put Texas on a whole other level for more economic growth.
And a great start, just to emphasize one of your points, would be for state leaders and members of the legislature to increase that 5% reduction to something like 25 or 30%. I think that's a wonderful way to sort of jumpstart the Texas economy. So we'll go from that thorny issue, although it really is pretty clear, to another thorny issue, which is the vaccine. So Dr. Edwards, this is coming your direction first, but for Chuck and for Vance, there's a policy side of this too, so be prepared. So this is from one of our online audience members. Once a vaccine becomes available, do any of the panelists have predictions regarding the implementation of requirements related to vaccination? Dr. Edwards, you get that first.
That's a hot topic. And my perspective may be a little different than what people have heard. I've looked historically at coronavirus vaccine attempts. Remember, we had SARS and MERS, and coronaviruses have been around. So they've attempted to make vaccines in the past, and I'm all for safe and effective. And in the past, what happened was these animal models, they gave the vaccine and it induced an antibody response, which that's the definition for FDA for a successful or effective vaccine, is an antibody response. But then they put those animals exposed them to the wild virus, the actual coronavirus they were vaccinated against. And it created an overwhelming immune response, an inappropriate overwhelming immune response, and the animals died. And it just points to the trickiness of being able, it's very, very difficult the way these coronaviruses operate. It's different than influenza, to make an effective vaccine. So that's number one, is just historically it hasn't been done. I'm not saying it can't be done, but we need to be very careful, not forget those lessons from the past. In fact, I think in the 1960s, they were trying to make one that actually skipped the animal trials, went to humans, and some kids died. And I'm not trying to bring fear. I'm just saying we have to talk about both sides. And especially in light of the data on the fatality rate. We know now the fatality rate is really similar to the flu. So flu vaccines are optional. We have to remember we have healthy people, especially the ones that have good host defenses. If you have healthy people and you're going to do a medical procedure to them, there has to be informed consent. There has to be a whole lot of evidence for a healthy person to undergo a medical procedure. So if there's no risk and it's beneficial, for sure, let's look at it. But I'm a little cautious because of historically, and then of course there's a lot of money and politics involved. So as a physician trying to find the truth and trying to give good informed consent, here's the risk, here's the benefit. And when the fatality rate's so low and in young people, it really doesn't affect you. We know host defenses can be improved. You know, it's going to be difficult for my opinion, to mandate anything for sure. Just from a philosophical standpoint, I believe medical procedures have to be voluntary, especially into healthy people, and especially in a virus that has such a low fatality rate. So that's my nutshell, but that's probably an hour-long answer I could get into there.
Well, you did a good job of distilling an hour into 2 minutes. I really appreciate the response, which is very thoughtful. Chuck, I'm going to ask you to follow up on that from the perspective of politics and policy. And then Vance, I want to pitch one more question to you about the economy, and then we'll begin to wrap up. Chuck? So
the doctor had some very good points about coronavirus. I think it's similar to the common cold. There's a reason why we don't have a vaccine for that. It seems to mutate relatively quickly. And then the challenge with this with the vaccine is that you have politicians and our, as Vance pointed out earlier about the tyranny of experts, our medical community at CDC and the National Institute for Health really made a big deal out of this virus. And of course, a lot of that had to do with early information, much of it false, coming out of the People's Republic of China. And so after you've created this unstoppable juggernaut in caused a lot of fear, naturally then people are drawn to the idea that there might be some sort of foolproof way that you could make yourself safe from the virus. And now on top of that, it's being politicized, right? You have a running mate of one of the major parties saying that they wouldn't trust a vaccine. And so all of this effort, as the doctor pointed out, billions of dollars as well have been expended, maybe for naught, because the vaccine may not be safe, it may not be effective. And even if it is effective, there's so much fear and uncertainty that has been injected by our body politic and by the media that frankly, a lot of people probably wouldn't take the vaccine, even if they were vulnerable to succumbing to the virus.
Thanks for that perspective, Chuck. So Vance, last question from the audience, and this is about the economy. What might we expect to see happen as a result of people postponing their mortgage and other loan payments? It's also a question about looking into your crystal ball as an economist, having worked in the White House. What's the prediction for the next 3 months, for the next 3 years, for that matter?
Yeah, it's an important question, and it's one that will need to be studied and considered for a while, given the effect that it could have on the real estate market. Right now, the Texas real estate market is still pretty hot. I was just talking to one of my good friends who was a realtor here in Austin, and he was saying how much that, there's 14, 15 people are trying to buy one home right now. Demand is really high as some people are wanting to move out to the suburbs. Maybe they're working remotely. A lot of the IT firms across the state have now said that you can work remotely indefinitely. So why would you want to live in an urban area when you could go find some other good places across this great state? And why wouldn't you, if you're in California paying high costs, move to Texas or to New York? We have to be careful because we might have too many Chuck DeVores over here.
We'll take more Chucks.
Yeah. But we have this idea of what's going to happen with the overall real estate market. You have very low interest rates right now, and the Federal Reserve has said that they're probably going to leave rates low until 2023, if you can imagine that. And so that also contributes to the incentive to buy a home because it's a lower cost overall. So we need to be thinking about the supply and demand that goes into that. One of the other things about the economy is that this has really affected some people more than others, particularly the white collar sort of jobs that can work remotely. They've continued to have their jobs. But when you look at leisure and hospitality over the last year, I was looking at some numbers earlier, they've lost 250,000 jobs over the last year since last August. The total private sector has lost almost 600,000. So that means 50% of the job losses has been in just the leisure and hospitality area. You add in mining and logging, as we know mining and logging has taken a big hit. That's about 53% of all jobs lost in Texas over that period. And so some are considering this maybe to be a K-shaped recovery, where those at the top continuing to see higher income gains, those at the bottom are going to have lower income gains or even job losses. And that's unfortunate. And what I hope we can turn back to was really what we saw during the last 3 years, where we had lower income inequality. We had a convergence from lower income people seeing a higher growth rate in their earnings compared to higher income people. I'm for everyone getting higher pay. You know what I mean? I don't want to get too lost in the income inequality sort of issues, but I think what you can see, if you reduce barriers and provide an inclusive economic environment, that creates more job growth and wage growth overall, so everyone can benefit within that process. And we need to get back to that as soon as possible. And I think it starts with reopening. Some things that we've looked at internally is if you look at hospitalization rates across the state and these different TSAs, 19 of the 22 under the 15% criteria that the governor announced recently, 19 of the 22 TSAs, that's 94% of the population, will now go from 50% to 75% capacity, right? But if you looked at total staffed beds instead of just the occupied beds, and you looked at just below 7%, right? Not the 15% rate, but the 7% rate, 81% of the state's population could be fully free, meaning that we could reduce a lot of these overall restrictions. And so I think that we're getting to a good measure with the hospitalizations, but we need to know the next steps. That's what businesses, that's what families are really wanting to know right now. We don't know what those next steps are yet, Kevin. So I hope we will get that soon.
And it's that uncertainty that continues to suffocate not just the economy, but our liberty. Well, gentlemen, you've done a fantastic job. I knew that coming in. And I want to be sure that I get to ask the last question, which I try to ask with each of these live streams. And that is, in spite of everything that's going on in 2020, this has been a challenging decade, this last 6 months. What words of encouragement, what optimism, because I know each of you is really optimistic in spite of all this, would you offer our audience? Dr. Edwards, I want to start with you.
Well, the number one thing that I've been telling my patients and people that I run with is there's been an opportunity in the shutdown to focus on our priorities, what's really important in life. And sometimes we get overwhelmed with so much stuff that we just can't say no to. And it can be all good stuff, really good stuff, but there's this point of we need to back off sometimes with all this extracurricular stuff and refocus our efforts on what's really important. And part of that's just getting around the kitchen table and preparing a meal together, real food, what I call God food, not man food. So the decreased consumption of man food has been a good thing. And so I'm very excited about the focus now. I think that more and more people are having on true health, those host defenses, family, the things that are really important in life. So the future is bright if we continue to focus on the truth, and there's always hope in the truth.
Thanks a lot, Dr. Edwards, for being part of this panel. You've added a lot. I was going to say you complimented what we said. You actually drove the conversation in ways that are really helpful. So thank you very much for joining us.
My
Chuck
pleasure.
DeVore, known as a great optimist when you were in the California Assembly.
It's probably what kept me there longer than I should have been. I think that the thing that people can be optimistic about in the state of Texas is even when we were at our worst, at our peak, as I saw that data, we never activated all of those emergency areas, the additional capacity that we identified and put in place, thinking that the system might be overwhelmed. We had at our peak something like almost 12,000 people hospitalized with COVID. Now we're down around 3,000. It's not going to go back to 12,000. And that's a really good thing. I think I think it's behind us. And I think the other good thing is that you're seeing among Americans kind of the resurgence of what has historically been a skepticism of their politicians and of experts. And you're beginning to see that, I think, reemerge as people who are social animals by inclination are just frankly getting sick and tired of being locked down and living under fear. And I think you're going to see Texas lead the way in that regard because we're Texans.
Thanks, Chuck. Dr. Ginn.
Well, I think it's a combination here. So what Dr. Edwards said was exactly right. More time with the family, more time with the boys, more time fishing and doing all those great things. To what Chuck said, not being so dependent on government. I think that would be a big thing. Back to preserving liberty, the role for government. And then, the last thing I would say is Texas is still that beacon of light on the hill. Like we're still the place where prosperity is going to come from. And if we can allow for our institutions to flourish and strengthen them, having no personal income tax, reducing our property tax to one day it's gone. Hint. Maybe one day.
I took the hint. Thanks.
Okay, good. But other things along those lines where we can continue to have the prosperity that we know to be true here in Texas, and why people flock to this state. I was in DC for about a year, and it's just a different place, and it's just great to be back in Texas, back at the foundation, and continuing to do all the great work that we're all doing here, that the people are doing at this Pink Capitol right down the road here. It's remarkable what we can get done, and I know that we will be able to do if we continue to have these three things together.
Dr. Vance, Ginn, Chuck DeVore, Dr. Ben Edwards, you've been great. Thanks so much for the wisdom. I know that our live audience, our live stream audience really appreciate what you had to say. And I would just underscore one thing that I think is the theme in the last comments that the three of you made. And that is, we're grateful to our elected officials. I don't think any of us envy the positions they've been in. We know that here in Texas, for example, and in a few other states, the partial reopening plan is opened the door a little bit. But I'm just going to be blunt and say it's not enough. And it's not enough because we're making data-driven decisions. You heard three experts here today talk to you about the need to open now. And I actually go to history and philosophy and understand that with a free people that we have kept bottled inside, rather literally, unfortunately, in 2020, that when you open that door a sliver, they want to tear the doors off. And so don't complain about a free people wanting to be free. What we need from our elected officials now, every single elected official, is a plan of how this ends. When do we get to take the masks off? When do we have to stop social distancing? When will you trust us as your constituents to make decisions for ourselves? That's what the Texas Public Policy Foundation wants to know. And that's what we're going to be asking every day until it ends. Thanks so much for joining us today. Thank you, my TPPF colleagues, for being here in person. Next time we'll have lunch. To Vance, Chuck, Ben, thanks again. May God bless.